Hello everyone, this is my YouTube channel. Today I will talk about a very common and dangerous disease, which is type 2 diabetes. This disease can cause serious complications for health if not detected and treated in time. So what is type 2 diabetes? What are the causes, symptoms, diagnosis and treatment of the disease? Let's find out with me. Type 2 diabetes is a chronic metabolic disorder in which the body cannot use glucose due to insufficient insulin production or insulin resistance or both. Normally, the body gets energy from components such as glucose, lipids, proteins. Among them, glucose provides the main source of energy for cells, for the brain, muscles, to function. But to use glucose, insulin is needed. Insulin is a hormone produced by the pancreas. Insulin helps sugar, glucose, from the blood move into cells, where it is metabolized and creates energy. When the body cannot use glucose, it accumulates in the blood, causing high blood sugar. High blood sugar can cause dangerous complications such as heart attack, stroke, kidney failure, blindness, and nerve damage. The cause of type 2 diabetes is still unknown. However, there are some factors that can increase the risk of developing the disease, such as obesity, the leading risk factor for type 2 diabetes. When the body has too much fat, especially in the abdomen, it reduces the ability to use insulin, causing insulin resistance. Age. The older, the less sensitive to insulin. People over 45 years old have a higher risk than young people. Genetics. If you have a family member with type 2 diabetes, you also have a higher risk, especially if your father or mother has the disease. Diet. Eating a lot of foods high in fat, sugar, starch, low in vegetables, fruits can increase the risk of type 2 diabetes. Lack of exercise. Not exercising regularly will reduce the ability to use glucose, accumulate fat, and reduce sensitivity to insulin. Other diseases. Some diseases can affect the function of the pancreas or increase insulin secretion, such as pancreatitis, Cushing's disease, acromegaly. The symptoms of type 2 diabetes usually develop slowly. Most of them are accidentally discovered. Or patients may go for a checkup for some symptoms such as the classic symptoms of diabetes: eating a lot, drinking a lot, thirsty, urinating a lot, due to high sugar in urine, causing osmotic diuresis, losing weight. Type 2 diabetes patients usually have obesity, but when they have symptoms of uncontrolled hyperglycemia or newly discovered diabetes, they may have a stage of unexplained weight loss, unintentional. Symptoms when complications occur. Acute complications such as hyperosmolar coma. An acute complication, common in type 2 diabetes. Type 1 often has ketoacidosis. Manifestations of weakness, fatigue, thirst, dry skin, cramps, fast pulse, low blood pressure, signs of dehydration, impaired consciousness, drowsy, sleepy, coma. This condition progresses gradually over several days to weeks. Chronic complications such as blurred vision, due to retinal complications, cataracts, chest pain often atypical, due to coronary artery complications, numbness, paresthesia in the feet, nerve complications, ulcers, foot infections, bloating, constipation, difficulty swallowing, autonomic nerve complications causing gastric, esophageal paralysis. Diagnosis of type 2 diabetes is based on blood sugar tests. According to the American Diabetes Association, there are 3 ways to diagnose diabetes in general. Any blood sugar greater than 11.1 mmol/L with symptoms of hyperglycemia, eating a lot, drinking a lot, urinating a lot, losing weight. Fasting blood sugar, fasting greater than 814 H, greater than 7 mmol in 2 different mornings. Blood sugar after eating 2 hours greater than 11.1 mmol/L. HbA1c. Average blood sugar in 3 months, greater than 6.5%. In addition, some other tests can be performed to assess the complications of the disease, such as blood lipid tests, kidney function, eye, cardiovascular. Treatment of type 2 diabetes includes lifestyle changes, an important milestone in controlling the disease. You need to follow these principles. Eat a healthy diet. Eat less sugar, starch, fat. Eat more vegetables, fruits. Exercise regularly, at least 30 minutes a day, 5 days a week. Exercise increases the sensitivity of cells to insulin. Lose weight. Reduce insulin resistance. Control blood pressure. Treat other metabolic disorders, lipid disorders. Use drugs. If diet and exercise are not enough to control blood sugar well, you may need to use diabetes drugs. There are different types of drugs with different effects, such as increase insulin secretion, such as sulfonylurea, meglitide. Reduce insulin resistance, such as biguanide, metformin, thiazolidinedione. Reduce sugar absorption from the intestine, such as alpha-glucosidase inhibitor. Reduce sugar reabsorption from the kidney, such as SGLT2 inhibitor. Reduce glucose release from the liver, such as DPP4 inhibitor. Reduce glucose absorption from the blood, such as GLP-1 receptor agonist. You need to consult your doctor to choose the right drug for your condition. You also need to monitor the side effects of the drug and adjust the dose according to the doctor's instructions. Use insulin. If the drug is not enough to control blood sugar well, you may need to use exogenous insulin. There are different types of insulin, with different durations of action, such as short insulin, acts within 30 minutes, lasts for 3-6 hours. Intermediate insulin, acts within 2-4 hours, lasts for 12-18 hours. Long insulin, acts within 6-10 hours, lasts for 20-24 hours. Ultra-long insulin, acts within 6 hours, lasts for 36 hours. You need to consult your doctor to choose the right insulin for your condition. You also need to learn how to inject insulin properly and safely, as well as monitor the side effects of insulin and adjust the dose according to the doctor's instructions. That's the information I want to share with you about type 2 diabetes. I hope you will have more knowledge to prevent and treat the disease effectively. If you have any questions, please leave a comment below. Thank you for watching my video. See you again in the next video. Goodbye.